My chosen theory is understanding the perceived threat of the risk of graft rejections, a middle range theory. Here, graft rejection is understood to be the transplant of a solid organ, whether that's liver, kidney, heart, or lungs. And this theory or article is about the anxiety that patients perceive or experience that their transplant will be rejected, and the practical steps that can be taken in order to minimize both the rejection and their anxiety. None of the four meta paradigms of nursing are specifically defined in this middle range theory. However, they are implied. Person is understood to be someone who is striving to maintain the health of a graft and prevent rejection, whether that is the patient, a family member, or healthcare staff. The environment is a potential threat to the graft with so many opportunities that could introduce stress or infection, both of which increase the likelihood of rejection. And health is defined as maintaining the psychological and physical equilibrium to maintain the transplanted organ. And nursing is seen as a professional role that educates the patient and family about how to minimize infection and minimize the possibility of rejection, that reassures them of the possibility of maintaining the transplant and living a high quality of life, and also sets the example of how to maintain a clean environment to minimize the risk of infection. This theory fits well into my practice setting of the surgical ICU because we have lots of transplant patients. Almost daily, we receive a liver transplant, sometimes even more than one. And on a regular basis, even if not daily, we also receive kidney, heart, and lung transplant patients. With all of these transplant patients, we regularly have the opportunity to practice neutropenic precautions and to teach patients and their family members about preventative measures. And there are several interventions that flow directly from this theory that influence patient care. The first is assessment and education. The patient needs to be assessed physically from head to toe, as with any patient, but also psychologically. Remember that before this surgery, many of these patients probably experienced poor chronic health and were not living the highest quality of life possible. And the transplant surgery itself is very stressful. So you have to make sure that they are in the right frame of mind in order to receive any education that you want to offer them. But there's also an increased likelihood of depression. And if there is depression, then they may not be able to receive the education that you want to give them. They may not be able to comply consistently with infection preventative measures. They're just experiencing more stress in general in their body, which is not good. And finally, if they need to take any medications for the depression, then it needs to be ensured that these medications are friendly to the organ that they have just received. Second, the intervention that needs to be practiced is using protective measures to minimize the risk of introducing infective agents to the patient. So hand hygiene is a must, as with all patients. In addition, all staff and visitors are asked to use a surgical mask when entering the patient's room, and healthcare staff must clean their stethoscope between patients to make sure they do not transfer microbes from one patient to another. So hopefully the implementation of this theory will give greater assurance to both patients and providers that the risk of graft rejection will be minimized.